After my second baby, I couldn't sleep. Even when the baby was asleep, I'd lie awake checking that she was breathing. Every 5 minutes, all night, every single night. I'd Google every symptom, every rash, every normal baby sound. I wasn't sad. I was terrified, constantly. That's when I realized I didn't have postpartum depression. I had postpartum anxiety. Today, I'm talking about what nobody warned me about. Because anxiety after having a baby is real, it's common, and you need to know the signs. Everyone knows about postpartum depression. But postpartum anxiety? That gets talked about way less. Here's the reality. Postpartum anxiety is at least as common as postpartum depression. Studies suggest 10 to 15% of new mothers experience postpartum anxiety. Some research says it's even higher. The difference. Postpartum depression is characterized by sadness, hopelessness, feeling disconnected. Postpartum anxiety is characterized by excessive worry, fear, and physical symptoms of anxiety. You can have one without the other. You can also have both at the same time. What it is. Postpartum anxiety is when the normal new parent worry becomes excessive and interferes with your daily life. It's when you can't turn off the what-if thoughts. What if baby stops breathing? What if I drop her? What if something's wrong that the doctors missed? What if I'm failing as a mother? These thoughts loop constantly. They feel impossible to control. Why it happens? Hormones crash after delivery. Estrogen and progesterone drop dramatically. Sleep deprivation makes anxiety worse. Your nervous system is on high alert. The responsibility of keeping a tiny human alive is genuinely overwhelming. If you had anxiety before pregnancy, you're at higher risk. But it can happen to anyone. This is not weakness. This is your brain chemistry responding to massive biological and life changes. Let me walk through what postpartum anxiety actually looks like, because sometimes you don't realize what's happening until someone names it. Constant worry. You worry excessively about baby's health and safety. Even when the pediatrician says everything is fine, you can't believe it. You Google symptoms constantly. You look for problems that aren't there. You check on baby multiple times per night, even when they're sleeping peacefully. One NICU check becomes 5 checks. 5 checks become 10. Physical symptoms, racing heart, tightness in your chest, shortness of breath, feeling like you can't get enough air, nausea, loss of appetite or eating constantly to cope, tension headaches, jaw clenching, muscle tension, dizziness or feeling lightheaded. These physical symptoms can feel like something is seriously wrong medically. You might even go to the ER thinking you're having a heart attack. That's how real the physical symptoms of anxiety are. Sleep problems. This is a big one. It's not just that the baby is waking you up. It's that even when baby is sleeping, you can't sleep. Your mind races. You lie awake worrying. You check your phone. You watch the monitor obsessively. You're exhausted but too anxious to sleep. Intrusive thoughts. These are unwanted, scary thoughts that pop into your head. Visions of something bad happening to baby, dropping them getting hurt, them dying. These thoughts are not the same as wanting to hurt your baby. They're anxiety manifesting as worst-case scenario images. They're terrifying, and they make you feel like something is wrong with you. But they're a symptom of anxiety, not a sign that you'll act on them. Avoidance. You might avoid certain activities because of anxiety. Won't let anyone else hold baby. Won't let partner give a bottle because only you can do it right. Won't take baby out of the house because something might happen. Won't drive with baby in the car. The world feels dangerous and you're trying to control everything to keep baby safe. You are not alone. If you are struggling, reach out to your healthcare provider or a postpartum support helpline for help and resources. Hypervigilance. You're constantly on edge, scanning for danger. Every sound, every movement, every change in baby's breathing pattern triggers alarm. You can't relax, ever. Your nervous system is stuck in fight or flight mode. Difficulty concentrating. Your mind is so full of anxious thoughts that you can't focus on anything else. Someone is talking to you and you can't follow the conversation. You read the same sentence 5 times and don't absorb it. You forget things constantly because your brain is maxed out with worry. Irritability. Anxiety often shows up as irritability or anger. You snap at your partner over small things. You feel rage when someone gives you advice. You're short-tempered with everyone. This isn't your personality. It's your nervous system being overwhelmed. Let me tell you what happened to me after my second baby. I thought I was fine. I wasn't sad. I was functioning. But I was constantly terrified. The breathing checks. I checked that she was breathing every 5 minutes when she slept. I'd put my hand on her chest, listen for breath sounds, watch for movement. 5 minutes later, I'd do it again. I couldn't stop, even though I knew rationally she was fine. My husband would say, "She's sleeping, she's breathing, you need to sleep." But I couldn't. The anxiety wouldn't let me. The catastrophic thinking. Every time I drove with her in the car, I imagined car accidents. Every time someone held her, I imagined them dropping her. Every tiny rash was meningitis. Every sneeze was pneumonia. I took her to the pediatrician 4 times in the first month for things that were completely normal. The doctor finally asked me gently, "How are you doing?" I started crying. I couldn't remember the last time I'd felt calm. The turning point. My husband found me at 3 a.m. sitting next to the bassinet, just staring at the baby. She was sleeping peacefully. I was wide awake, heart racing, mind spinning. He said, "This isn't normal worry. Something's wrong." I was angry at first. Nothing was wrong. I was just being a good mother, being careful. But deep down, I knew he was right. This level of fear wasn't sustainable. It wasn't healthy. Getting help. I called my OB the next day. She said the words that changed everything. "This sounds like postpartum anxiety." Not depression. Anxiety. Suddenly it made sense. I wasn't sad. I was scared. All the time. She referred me to a therapist who specialized in postpartum mental health. Within weeks of starting therapy and considering medication, I felt different. The intrusive thoughts lessened. I could sleep when baby slept. The constant dread lifted. I wish I'd recognized it sooner. I lost weeks to that anxiety. Here's the question everyone asks. How do you know if it's normal worry or postpartum anxiety? Normal new parent worry. You check on baby while they sleep, once or twice per night. You worry when baby seems sick, but you trust the doctor's reassurance. You can sleep when baby sleeps, even if it takes a few minutes to wind down. You feel stressed and overwhelmed sometimes, but also moments of joy and calm. You can focus on other tasks when baby is being watched by someone else. Postpartum anxiety. You check on baby constantly, multiple times per hour, even when they're fine. Even when the doctor says baby is healthy, you can't stop worrying. You physically cannot sleep even when you have the opportunity. The worry is constant and doesn't let up. You can't access feelings of joy. When someone else is watching baby, you're consumed with anxiety and can't focus. The key difference: normal worry comes and goes. Anxiety is constant. Normal worry responds to reassurance. Anxiety doesn't. Normal worry lets you function. Anxiety interferes with daily life. If you're asking yourself, is this normal? That's already a sign it might not be. Trust your instincts. If it feels like too much, it probably is. Anyone can develop postpartum anxiety, but certain factors increase your risk. History of anxiety or depression. If you had anxiety before pregnancy, your risk is higher. But even if you've never had mental health issues, you can develop postpartum anxiety. Traumatic birth experience, complicated deliveries, emergency C-sections, NICU stays, these increase anxiety risk. Your brain went through a traumatic experience. Anxiety is a normal response to trauma. Sleep deprivation. Chronic sleep deprivation makes anxiety exponentially worse. Your nervous system can't regulate properly without sleep. Lack of support. If you're doing this alone, single parent, partner who isn't helpful, no family nearby, the stress is higher. Isolation breeds anxiety. High-need baby. Babies with colic, reflux, feeding difficulties, or sleep problems create more stress. It's harder to feel calm when baby is struggling. Perfectionism. If you're someone who likes control and gets things right, new parenthood can trigger anxiety. You can't control a baby. You can't do everything perfectly. That's terrifying for perfectionists. Previous loss. If you've had a miscarriage, stillbirth, or infant loss, anxiety and subsequent pregnancies and postpartum is common. The fear of something happening again is overwhelming. Here's what's important. Postpartum anxiety is treatable. You don't have to suffer through this. You don't have to white-knuckle your way to getting over it. There are effective treatments. Therapy. Cognitive behavioral therapy, CBT, is highly effective for anxiety. It helps you identify anxious thought patterns and replace them with more realistic ones. You learn coping strategies and relaxation techniques. A therapist who specializes in postpartum mental health understands what you're going through. You don't have to explain why you're worried your baby will stop breathing. They get it. Medication. Anti-anxiety medications and antidepressants can help. SSRIs, selective serotonin reuptake inhibitors, are commonly prescribed and most are safe for breastfeeding. Many women resist medication. I understand that. I resist it too. But medication can be life-changing. It can give you your life back. Talk to your doctor. Ask about risks and benefits. Make an informed decision. If you're breastfeeding, ask specifically about medications compatible with breastfeeding. Most are. Don't let that stop you from getting help. Lifestyle changes. These don't cure anxiety, but they help manage it. Sleep. Prioritize it however you can. Have partner do night feeds. Nap when baby naps. Sleep is crucial. Exercise. Even a 10-minute walk helps. Movement reduces anxiety. Nutrition. Eat regularly. Low blood sugar makes anxiety worse. Limit caffeine. It can worsen anxiety symptoms. Reduce social media comparison and doom scrolling increase anxiety. Support groups. Connecting with other mothers experiencing postpartum anxiety helps immensely. You realize you're not alone, you're not broken. This is a real condition. Look for postpartum support groups, in person or online. Postpartum Support International has resources and support groups. Partner involvement. Your partner needs to understand what's happening. They can help by taking over certain tasks, encouraging you to get help, reassuring you without dismissing your feelings. The baby is fine doesn't help. I hear that you're scared and we're going to get you help does. Most postpartum anxiety is manageable with treatment, but there are signs that you need help right now. Seek immediate help if you have thoughts of harming yourself or your baby. You're having panic attacks that make you feel like you're dying. You can't care for yourself or your baby because of the anxiety. You're so paralyzed by fear that you can't function. You're experiencing hallucinations or delusions. These symptoms might indicate postpartum psychosis, which is a medical emergency. Where to get help? Call your OB immediately. Call your primary care doctor. Call a postpartum support hotline. Postpartum Support International 1-800-944-4773. Go to the ER if you feel unsafe. Text or call the 988 Suicide and Crisis Lifeline if you're having thoughts of harming yourself. Do not wait. Do not tough it out. Postpartum mental health emergencies are real emergencies. While you're getting treatment, here are some strategies that help. Grounding techniques. When anxiety spikes, use the 5-4-3-2-1 technique. Name 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, 1 thing you can taste. This brings you back to the present moment instead of spiraling into what if. Breathing exercises. Deep belly breathing activates your parasympathetic nervous system, the calm down system. Breathe in for 4 counts. Hold for 4. Breathe out for 6. Do this for 2 minutes when you feel panic rising. Limit checking behaviors. If you're checking on baby constantly, set a timer. Check once per hour instead of once every 5 minutes. Gradually extend the time between checks. Challenge the thoughts. When an anxious thought comes up, what if baby stops breathing? Challenge it. Is there evidence of that? Baby is healthy. The monitor is working. I checked 5 minutes ago. You're retraining your brain to assess risk realistically. Ask for help. Let someone else hold baby while you shower, nap, or leave the house. It will feel impossible. Do it anyway. Your anxiety will spike. That's okay. The anxiety will pass. Be honest. Tell your partner. Tell your partner. Tell your partner. Say, I'm struggling with anxiety. I need support. People can't help if they don't know. I want you to hear this clearly. Postpartum anxiety is temporary. It does not last forever. With treatment, therapy, medication, support, you will feel better. You will not feel like this for the rest of your life. What recovery looks like, you'll start sleeping better even when you have the opportunity. The intrusive thoughts will lessen. They might not disappear completely, but they'll lose their power. You'll be able to let someone else hold your baby without panicking. You'll have moments of joy and presence instead of constant fear. You'll recognize that most of the things you worried about never happened. It takes time. Recovery isn't linear. You'll have good days and bad days. Some days you'll feel like yourself again. Other days, the anxiety will spike. That's normal. That's part of healing. Don't give up on treatment if you don't feel better immediately. Medication takes weeks to work. Therapy takes time to change thought patterns. Keep going. It's worth it. You're not alone. Millions of mothers have experienced this. You're not failing. You're not weak. You're not broken. You're experiencing a treatable medical condition, and you deserve help. You deserve to feel better. Your baby needs you healthy. Taking care of your mental health is taking care of your baby. If you're struggling with postpartum anxiety right now, please get help. Call your doctor, find a therapist, reach out to Postpartum Support International. You do not have to suffer through this alone. And if you know someone who just had a baby, check in on them. Don't just ask about the baby. Ask, how are you doing? Really? Sometimes that question is the opening someone needs to admit they're struggling. Drop a comment if you've experienced postpartum anxiety. Your story might help someone else recognize what they're going through. Next video, we're switching gears to toddler tantrums, why they happen, and how to handle them without losing your mind. Because the postpartum period eventually ends, and then you have a toddler. See you there, Mama. You're doing better than you think, I promise.